Hello, my name is Arya Javidan. I'm the project manager for the National Consortium of Telehealth Resource Centers. Welcome to today's webinar, The Importance of Operations Planning for Telehealth, How to Develop a Plan that Works. Today's webinar is hosted by the Upper Midwest Telehealth Resource Center, and these sessions are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. Just to provide a little bit of background on the consortium, located throughout the country, there are 12 regional telehealth resource centers and 2 national, one focused on telehealth policy and the other on telehealth technology assessment. Each serve as focal points for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. We do want to highlight that the consortium is collecting success stories from organizations, patients, and providers who have benefited from telehealth with support from a telehealth resource center. Share how your TRC helped make telehealth work for you for a chance to be featured along with your organization in our consortium newsletter, and we've included the link as well as a QR code to the survey there. A few tips before we get started today. Your audio has been muted. Please use the Q&A function of the Zoom platform to ask questions. Questions will be answered at the end of the presentation. Please only use the chat feature for communicating issues with technology or communication access issues. Please refrain using the chat to ask questions or make comments. Please also note that closed captioning is available, and that is located at the bottom of your screen. Today's webinar is also being recorded, and you will be able to access today's and past webinars on the NCTRC YouTube channel and the NCTRC website at telehealthresourcecenter.org. With that, I will introduce our speaker for today, Danielle Renckly. Danielle joined the Indiana Rural Health Association in 2022 as a program coordinator for the Upper Midwest Telehealth Resource Center. She also serves as the host of UMTRC's podcast, A Virtual View. Prior to joining IRHA, Danielle was part of the Division of Emergency Preparedness at the Indiana Department of Health. While there, she served as part of IDOH's response to the COVID-19 pandemic. She holds a Bachelor of Science in Sociology with a focus in statistics and inequality from Ball State University. With that, I will pass it over to Danielle.
Thank you so much, Aria. Can you hear me okay?
Yes.
Fantastic. All right, let me just share my slides. Okay, can you see my slides and not my notes?
Yes, looks good.
Fantastic. Like Aria said, my name is Danielle Renckly. I am a program coordinator with the Upper Midwest Telehealth Resource Center. I've also got some experience in emergency preparedness planning with the state of Indiana, so I will be referencing that a little bit today. But I love operations planning, so I'm really excited today to chat about why operations planning is so important for your telehealth program and what we can do to develop a plan that really works. So without further ado, let's get started. Also, I am a bit of a chatterbox, so I will try my best to leave time for questions at the end. And please don't hesitate to ask those. Like Aria said, I am our podcast host. I love answering questions. Okay, just our standard disclaimers here. Okay, so our objectives, what we're going to talk about today. First, we're going to go over why building a plan is so important. Then we're going to talk about how you and your program can identify what elements you need for your plan and how you're going to gather those. And then we're going to talk a little bit about how you can future-proof your plan and about how you can bring in new emerging technologies in a way that really works. So let's get started. First question I want to ask, I like to start presentations with a question. If somebody new joined your team tomorrow, could they figure out how your program operates? And in some cases, the answer is going to be yes, of course, my program is very simple. And others, it's probably going to be no, there's a lot going on. But so you can answer that question as a yes across the board. That's really where an operations plan is going to come in. So no matter how good your operation is, without a plan that covers what you do and how you do it, you're going to be super vulnerable to losing your ability to perform. So why an operation plan matters is that we can turn a discrete operation. So if I am a telehealth practitioner and I'm running a really successful operation, I can turn that into a sustainable long-term program if I have an operations plan that describes all the steps that I'm taking. It also creates a consistency no matter what size your program may grow to or shrink to. And we'll talk more about that later. It's also going to reduce your reliance on individual staff knowledge, and it's going to support training and scalability. And we're going to talk about what all of that means throughout the presentation, so don't worry. Okay, so if we have an operations plan, we're going to be able to preserve our knowledge of how stuff works independent of our staff members. I'm sure we all have that one person on our team or at our organization who knows how everything works, knows where all the contacts are, knows where all the bodies are buried, that kind of thing. And when we lose that kind of person, if we don't have a plan in place, if we don't have our operations correctly documented, we're going to be very vulnerable to losing out on processes, losing out on contacts, and losing out on the things that make our program great. And so if we know those things that make our program great, we can duplicate those successful processes, those successful operations. And if we don't have those written down, we might lose those. And that's a real shame. Another part is if we are starting a new person in our organization, in our program, what have you, they're going to have a lot of questions, obviously. If they have an operations plan to go off of, if all of your staff has a consistent plan that they're working from, questions are going to be answered in a really consistent way. Like, what do we do if this occurs? Oh, well, you can see in our operations plan that we have a plan right here for that. Answers to questions are going to vary if we don't have a plan available, and that can be very confusing for new staff as well as experienced staff. And then this isn't all just about preserving the good things. If there's something in our program that is really not working, if we have an operations plan available, it's going to be a lot easier for us to identify where that process is sort of failing and how we can fix things. So an operations plan isn't just for preserving what works, it's for identifying what doesn't as well. So obviously, we want a reliable program, not just one that's great today, but one that's great next week and next year, no matter what's happening in our organization or in the world surrounding us. So a telehealth program is really only going to be as reliable as the plan that's going to support it. And we're going to go into, I like using examples. I think they help to contextualize things. So we're going to talk about a real example, and that's the example of COVID-19. So something about me, and I think this was mentioned in my intro, prior to my role now, where I'm part of the Upper Midwest Telehealth Resource Center, the best telehealth resource center, don't tell the others, but I was a planning manager for the Indiana Department of Health, specifically for the Department of Emergency Preparedness. And so I was working there during the COVID-19 pandemic, and we saw a lot of providers and healthcare organizations trying to provide care for folks in a way that they just hadn't before, specifically through telehealth. And something that we saw a lot of was the very quick standing up of telehealth programs. And they really ran the gamut. Some were very effective and efficient, and others were less so, shall we say. So this is when we saw providers scrambling and using FaceTime to speak with patients. We all remember we were there. But what almost all of them had in common is that they were very reactive, and that oftentimes there was not a plan that was being followed, or if there was, it was very much an existing plan that was being bent to fix circumstances that was very much not written for. So we saw operational plans being used that were originally developed for normal in-office operations, and they were being used for telehealth operations, which was very clearly not as effective as it could be, because a telehealth operation is going to require different things than an in-office operation is. So hence, like using the FaceTime for appointments. We didn't have a HIPAA-compliant platform set up, so there was a lot of stuff that got dropped, a lot of processes that were not operating as effectively as they could. So what was missing? Obviously, there was a lot missing during this time. We saw the lack of PPE, but what I want to talk about today is that operational planning was the thing that was missing. So in a circumstance like COVID-19, it might seem like taking a step back to do ops planning is a huge waste of time. Whether your program is like new or has existed for a while. But I'd argue that during a situation like COVID, that is the best possible time for you to take a step back and do some operational planning, whether your program is going very well or it's going not so great and maybe needs some improvement. So if we're succeeding and not documenting in a situation like this, we can't replicate the processes that are really working later on. And if we'd really like to be doing better, if we're just not having a good time, we can't see where things are failing and we don't know what should be happening instead. And if we have an operations plan, we can determine where those failures are happening. So COVID and everything that happened during it and then immediately after it, with our quickly operationalized telehealth programs, is a PSA, in my opinion, for why ops planning is so vital, especially now that we're a few years out, a few years into air quotes, the new normal. We see so many lessons that were learned being lost by healthcare organizations, by practices, by providers of all sizes. So I'll go back to this throughout our presentation today, the COVID example, because it is, in my opinion, one of the biggest sort of examples we could ever have of why operational plans are so vital to either building or maintaining a really great telehealth program, which is what we all want to do. So our operations planning timeline, when should I start? Is there a specific day? So you all heard the saying, I'm sure, that the best time to start is yesterday, but the next best time is right now. And this is true for if you have an existing program, if you've been running your telehealth program for 10 years and you don't have an ops program or an ops plan, or you have a new program that you're trying to start. So in both cases, your time to start your operational plan is right now. So if we have an existing program, let's start our plan right now. If we are trying to build a new program, let's build the plan as we build the program. And I have examples of both of this that I'm going to talk about later, and that it's going to look a little different if we're building the plane that we're already flying, so to speak, so far as an ops plan go, rather than like following a blueprint. But it's both going to be really important. So I've been harping on about why an operations plan is important. Let's talk about what one is. In the most practical, the most basic terminology, an operations plan is just a document that's going to answer the questions that you ask when you're running a program. In this case, a telehealth program. Sorry, I got the sparkling waters. So you need to be able to answer certain questions to understand how a program is running. So first of all, we want to answer all of the questions that we need to ask in practical, actionable terms. No like sort of vague, like, oh, it'll happen. It needs to be answered in this happens, and this happens. So some of the questions that we're going to want to answer: who does what? And this isn't just going to be who does what on like a provider end or an administrator end. It's also going to include patients. You should have patient workflows as well. We also want to ask, when and how do they do it? What are the triggers for that? And I'm going to use the word triggers a lot because they're what start different parts of a plan. So what tools and resources do we need? What's our equipment look like? What do we do when the usual process doesn't work? How do we troubleshoot? These are questions that we need to ask and then answer in an ops plan. And then most importantly, how do we know the process is working? Are we collecting metrics? Do we understand what's happening? All part of operations. So something I like to note is what an operations plan isn't, because some people try to make it all encompassing and it becomes really big and really unwieldy, and then it's not usable, unfortunately. So we want to keep our operations plans relatively focused. There are going to be separate documents like a business or marketing plan or a technology manual that are going to be separate but very related. It doesn't mean these elements aren't going to be included at all. Obviously, with a telehealth program, we're going to have technology information and equipment lists, stuff like that. But a full-scale technology manual is going to be something different. And every operations plan is probably going to have like some add-on documents, some appendices, all that good stuff. And what it's going to look like is just going to depend on your program. And we'll talk about that more in a little bit. Okay, so I'm not going to read all of these out, but this is an example of the elements that might be included in an operations plan. So you have things like what your program scope and goals are, your roles and responsibilities, various workflows, technology overviews, who our contacts are, clinical processes. So if you look at all this different stuff, answers to the questions that we ask around how this gets done is going to be essentially what an operations plan is. So a great first step when you're ops planning for your program, your organization, what have you, is to make a big web like this, to think, okay, what are the things that need to be answered for my program to develop a successful, effective operations plan? So yeah, a lot of this here is going to be stuff that everyone's going to need to answer if they want their operations plan to be effective. So a lot of what is and isn't included in your individual plan is going to be dependent on a couple things. So your type of program, your scale and scope, and what your patient population looks like, who you're serving. So obviously, something like an operations plan for a single provider telebehavioral health program is going to look really different from a multi-facility like telestroke program or something. You're providing different services, you've got a different scale and scope, you're just doing really different stuff. That being said, there are going to be commonalities, regardless of our size, of our scope, of what we're doing. The questions we discussed, who does what, how they do it, what they need to do. Those are all questions that are going to need to be answered regardless of the size of our program. How you answer those things, yeah, it's going to be different based on what you're looking for from your plan. A plan can be anywhere between 10 pages to 100 pages. I've seen them more than that. I wouldn't recommend it because they're unwieldy, but some programs need a plan that long. It really is just going to depend on the scale of your program, on the scope, and on what you're looking for. So don't feel restrained by what an operations plan is supposed to look like. What it's going to look like for your program, your organization is going to be different from what it looks like for your neighbor. So why is having a standard operating procedure such an important thing? So for one, it's going to ensure that we have a consistent experience for all of our patients as well as for all of our providers. And this is something that we saw being a big issue during COVID operations for some folks, particularly those who had never practiced telehealth before and were figuring it out as they went. So two people contacting the same program for the same issue might have a wildly different experience because the knowledge that the administration or providers are working from is going to be different. And we want to avoid that. And an operations plan is going to provide standard operations, standard procedures. This isn't to say that there's no flexibility. Obviously, anyone who's practiced telehealth knows that every appointment is a different appointment. There's going to be different stuff every time, but we want to be working from the same blueprint, sort of, so people can go in expecting what's going to happen, expecting a consistent quality of care, a consistent sort of appointment structure. It's also going to provide us with an easier onboarding and cross-training for new folks. If you've got new folks joining a telehealth program, rather than being like, okay, well, we do this and then we do this and trying to explain, you can just hand them an operations plan and say, okay, so this is how things work. If you have questions, please ask me. It's a lot easier and makes things a lot more consistent. There's also going to be fewer errors and missteps. This goes along with what I was saying with the first one. We saw during COVID a lot of errors with stuff like billing, a lot of errors with stuff like using FaceTime or something that was not HIPAA compliant to meet with patients. That's a big problem. So if we have those things documented, we can avoid making simple mistakes. There's also going to be easier troubleshooting. This is part of an operations plan that should exist, explaining what to do when things go wrong. If you have that in front of you, it's going to be a lot easier than trying to look it up on Google. It's also going to make, and we're going to talk about this more later, but it's also going to make expansion to new sites a lot easier. If we want to replicate successful processes, it's in the ops plan. And if we want to add new services, we can add it to an existing plan. So this is where my emergency preparedness experience is really going to come out. So apologies for that. I can and do yap on about this for quite some time, but I'll do my best to make it as brief as I can. But this is one of the things that makes operational planning so valuable for all programs, telehealth programs very much included. When an unexpected situation is going to come up, we have contingencies already outlined. And that can provide a big sense of like security to folks. And that's not just your patients, that's your staff as well. And a lot of times that security is going to be really needed, particularly if we're in like an emergency scenario, because there might not be a lot of security available. So text from the slide. To have a usable plan, we also need to plan for when things don't go according to plan. So in emergency preparedness, we can't just plan for blue skies. So first thing, there is a maxim that's commonly going to be repeated in preparedness and response spaces, and that is all emergencies are going to begin and end on a local level. And in my experience in both preparedness, telehealth, rural health, I've seen that to be both very true and very relevant to how we approach planning. So there's going to be different tiers of responses, but how you respond to them at a local level, at your individual practice, at your individual program is going to look very similar. So we have local things like extreme weather events, car accidents, what have you, single discrete events. We have larger state events like the flooding that's happening right now would be one of these. And then national things like global pandemics. So different types of responses are going to look different for folks operating at different levels, but oftentimes for our single preparedness programs, not preparedness, excuse me, for our single telehealth programs, the way that we respond to these things is going to look really similar, whether we're dealing with like flooding in our town or a global pandemic. So we want to be ready for any situation, and we want to write that into our operations plan. So within an operations plan, you're going to write, okay, this is what usually happens. These are the answers to the questions during blue sky scenarios. But we also want to plan for multiple types of emergency situations or public health events, what have you, that make sense for your program. So, for example, if I am operating telehealth in a town that frequently sees like extreme weather events, if I'm someone who's like in Florida or something like that, I'm going to want to write those things into my plan as I am creating it, because it's likely I'm going to see those things. And obviously, we cannot plan for every eventuality, nor should we be expected to. But if we make reasonable guesses and assumptions, a lot of times we'll have plans available, or we'll have plans that we can easily rework into whatever situation we're facing. So a couple of examples of things that we might want to plan for. Cybersecurity incidents, I would really recommend, particularly if you're a larger organization like a large hospital, having a cybersecurity like appendix annex to any operations plan you have, where you're like, okay, if we have like a ransomware issue, like this is what we're going to do. Here is our ABC steps to this plan, because like I said, that security it can provide is really invaluable. Severe weather or facility closure, this is a basic one everyone should probably plan for, because this happens. Loss of power or network, again, something you should plan for. How do we contact our patients to let them know that, hey, we're having to cancel appointments today because our Wi-Fi is down or our power is down in our like area, that kind of thing. Also unexpected staffing disruptions, something like that. If you are working from like a facility, and just because your patients can get on telehealth and operate remotely doesn't mean that your staff is going to be able to come in. So we need to plan for these things, for the things that make sense for your program. And also plan for ways that ordinary operations can also go wrong. We don't just want to plan for emergency scenarios. We want to plan for things that might happen on a day-to-day that could cause our plan to not work as intended. So if a patient has like a medical emergency during a virtual visit, that's something that should be accounted for in planning. if there is an unexpected staffing disruption, if there's like a big cold in your organization, if there's a technology failure, if a nearby facility has overflow, stuff like that. So we should be determining these things, one, before they happen, and we want to determine the triggers before they happen. So what that means is if we have a cybersecurity plan or cybersecurity operation within our ops plan, we want to have something that says, okay, this will take effect when XYZ happens. With cybersecurity, it's going to be really obvious. This will take effect when there's like a ransomware attack, something like that. But it can be like more up to discretion in other cases. Something like a pandemic or something. We could say if there is like 20% of staff, probably more than that, but something like if there's 30% of staff who is absent, it's time to activate this particular operation that means folks are going to work from home, something like that. So those triggers need to be built in and they need to be adhered to because the plan's only useful if it's based on like what's actually going to happen. And so, yeah, you got to build those triggers, you got to adhere to them. So fun example time after I take a drink. So earlier this year, the UMTRC, we worked with an FQHC up in the Chicagoland area called the Inner City Muslim Action Network. So they had initially stood up their telehealth operation during COVID-19. And in the years since, that operation had shrunk from being something where they were covering a lot of different stuff down to just covering some behavioral health appointments for folks who had like transportation issues. So they contacted us because they wanted two things. So they wanted to standardize their existing telehealth program so they could potentially expand it to other specialties and also bring in new staff if they needed. And then they also wanted to be able to use telehealth the way they did during COVID-19 for things like extreme weather events, which that's something that makes a lot of sense since that area gets pretty bad winter storms, that kind of thing. And a lot of their patient population, they mentioned, did have transportation barriers. They didn't have access to their own vehicles, reliant on public transportation or walking. And so obviously an extreme weather event, something like that, or even like a big event in Chicago is going to really hinder their ability to get to the facility. So we talked, we talked, and decided that creating an operations plan to standardize everything with a couple appendices, that kind of thing, was going to be the best way to address everything that they wanted to improve and document everything they wanted to do. So they'd also been struggling with staff turnover during this time and also a lack of interest in doing large-scale planning. So there wasn't the ability or really the appetite on their end to effectively do that in-house, which is where we collaborated. And that's something like operations planning. If you don't have the expertise in-house, there are ways to do it, collaborating with outside entities. So this ended up being a multi-step process for us. So we met with them to determine what information they had already gathered and what information they already had, and what we needed to work with their staff to record. And as it turns out, they actually did have a lot of information already available. It just wasn't in one place. And some of it really needed to be updated. It was like from years ago. And honestly, that's more common than you might think. Processes are usually going to be written down somewhere, but it might be on the desktop computer of a single employee, which was something that did happen to us, rather than in an operations plan where everyone is going to have access to it. So we gathered the info, verified that it was accurate, and then updated what needed to be updated. And then we helped them answer the additional questions they still needed to cover within the plan. So an important part of that was that we met with the entire team that was involved with providing telehealth. We met with the admins, we met with the nurses, we met with the providers, we met with the schedulers, everyone. So we could hear what their process looked like from then, not just like the program manager or the providers who we were working with directly up to that point. So we were able to verify every step within the plan with the people who were actually carrying them out. And that proved to be really valuable. So we'll talk about this a little more later. But one of the most important parts of an operations plan is that it's actual, not aspirational. So we can't we can improve processes, obviously, but we can't do that if we don't understand them first, how they're actually operating. So the outcome of this project, all that to say, was an operations plan that standardized their telehealth program. And it also expanded it a little bit. So instead of just providing behavioral health basically when they felt like it, which was what was happening up until that point, they had like a certain day a week when they were able to provide telebehavioral health, which was great. And then we were able to build a preparedness framework for what to do in a few different types of situation they might face. And that included everything from a couple of days to bad weather to potentially something like another pandemic. So that was an example of something that we did earlier this year. So we know what goes into a plan now and why we need one. Let's talk about the actual building process a little bit more. So I touched on this a little bit in our last example, but let's really dive into what it looks like after I take a drink. So our first step, like I said, is going to be gathering information. So we've determined the questions that we need to answer, and we need to gather our info. We need to find our important people. And that's going to be everyone, like I said, who is involved with a telehealth program. And that might look, for a smaller operation, smaller organization, like a couple people, to something that's larger, like dozens. So you're going to want to determine who is involved, who's making decisions, who's providing backup when those people aren't available, because there should be backup. And then making sure that they are all involved in this ops planning process. And then we want to document our processes. What's happening? How does it occur? What do we do when there are failures? All that good stuff. Then we want to identify the equipment that we're using, what systems and equipment are going to be required, and what are our dependencies for these equipments when they don't work. And that's one that's really important. And then we want to talk about our environment, and not just where stuff's happening, but what's going to affect us outside of just the process, just the operation. So does our organization have rules, requirements, and policies that we're going to need to make sure that we adhere to? Not to keep going back to my FaceTime example, but things like ensuring that the equipment that we're using is HIPAA compliant, like that's something that we should consider in our operations plan to make sure that we're doing things correctly like we should be doing. So how do we document our process once we have an idea of our information? So I want to work with our subject matter experts, and then I'm going to keep harping on about this, but it's important. We need to document our processes as they occur, not as we wish they would occur. So the steps for each different process that we have that we're going to want to document. We're going to start with our start or our trigger. Trigger is going to be more for like an emergency preparedness thing, like if we're having like a flood or something. But we also trigger things by like if somebody comes into our office, like that's also a trigger, or starts an appointment, schedules an appointment. So to explain this, we're just going to use the example of like a basic telehealth appointment. So the start to that is when the patient sits down, gets on their computer potentially, when they log in. It's going to look different for different processes, but we'll say it's when they log into like their MyChart account, whatever. And then we're going to talk about responsible roles. Who is doing stuff during this process? So we've got the provider who is logging on, but potentially we also have like a telehealth nurse who's doing the pre-provider stuff, collecting information, ensuring that the patient is able to log on okay. We might also have admin in the mix, like sending reminder texts to patients. We might have AI processes doing that, and those should also be documented. Then we're going to go through the required steps of this process, like patient logs on, provider logs on, that kind of stuff. Decision points, where things can change, and if they branch out into different processes, start documenting again from there. What things we need to document during this process. Are there any escalation points? Are we going to move to something else? And then what does our endpoint look like? So for a usual telehealth appointment, that's when the patient's going to log off. And then the provider is going to do note taking, whatever they need to do. And again, this is going to look different processes, different programs, but this is the basic idea of how you document a process. So this is just an example of what a table of contents in an operations plan might look like. This is actually from an ops plan I did a couple of years back, but so we start with section 1, background. That's going to explain if there's anything in the surrounding like area of the organization that we need to explain. Like for this operations plan I was working on, it was explaining the patient population that they were serving. There's like the background of the program, that kind of stuff. Section 2, program overview. All that went through, okay, this is what the program is called. This is what it provides. Then I went through regulatory and compliance. And this is like, here are the organizational policies, procedures, that kind of thing that need to be followed. Here are the policies and procedures for the state, and here are the federal ones. So just making sure that every rule that needs to get followed is documented and then followed. Then I went through technology and infrastructure. So it was things like, here's the different technology that we use, here's who's responsible for it, here's the systems that we use, like here's our EHR, here's our contacts for all these things. Then we went directly through the workflow and different operations, then staffing and training. So something that's important in staffing and training, we never want to be naming people in our operations plan beyond contacts, because jobs can, like people can leave a job, but that doesn't mean that that role doesn't need to be filled in an ops plan. So if I'm writing an operations plan, I want to say something like, then the admin coordinator does this. I don't want to say then Lisa does this, because if Lisa leaves, that plan is going to stop being accurate, and we want it to be accurate. And then quality and performance improvement. And these are ways that we maintain and improve our plan. We'll talk about that a little closer to the end. But yeah, this is just a basic table of contents for an ops plan that I wrote. There's a lot of different ways these can be structured. And while it's great to follow existing examples, don't do extra work if you don't have to. If this is not something that you think is going to work for your program, for your organization, build it differently. It doesn't have to be exactly the same for it to be effective for you. Okay, so last example. So this is a project that we are currently in the middle of. So we've been working with a team at North Central College, which is a small college in, I think, Illinois, to operationalize a telenutrition program working with a local food bank. A lot of it's education-based, and they've brought in community partners. It's great. So unlike the FQHC project that we mentioned, they're building the plan right now prior to when their program goes live. So we're in the midst of that process, like as we speak, had a meeting last week. So planning is going to look different for an established program, or that it does for one that's being developed like this one. So in the context of this project, their scope has changed a few times since like our initial meetings, their initial plan for this, as they've determined who partners are on this, like what they can ask from partners, what they really want to provide. So that might seem like planning is a waste of time. It might feel frustrating, but it really hasn't been. Oftentimes the scope changes came about when the team tried to answer the typical questions that you'd need for an operations plan, like who's responsible for this? What does this process look like? And realized the answers that they had weren't workable in the organization's current state. So we saved a lot of time and effort by trying to do that planning as we went, rather than going back and doing it at the end. So this is a program that has had a longer time period than my last example. We've been working with them for a couple months, because the planning process when a new program is being developed is going to look different than one where you're documenting stuff that's already happened. A lot of what we did when we were documenting an existing program and creating an operations plan for them that way involved finding information that was already there, or just documenting things that were already happening. This is creating it like whole cloth. So there's a lot of questions that we need to answer where the answers are not readily available. And that's fine. It just means that the planning process is going to look pretty different. So whether we are documenting a process, a program that already exists, or building something totally new, our end goal is going to be the same. And that end goal is going to be a plan that's usable by newcomers to our program and experts alike. It should be usable by everyone. We can't write it with a lot of technical jargon if we expect new people to be able to understand it. I am guilty of using acronyms all the time, but write them out at least once before you use them all over your operations plan. Another appendix I always add as well is a big one that's got all of your acronyms defined. So just a little tip there. So this is something that I mentioned earlier, and I want to get into it. So a plan needs to reflect what is actually happening in our program, not what we want to happen. So, and that's the actual versus aspirational. So, example, if we're using one EHR, but eventually we want to switch to another one, the plan should reflect our current process. That doesn't mean we can't improve our processes. If we do want to swap to a new EHR like later this year, next year, fantastic, great. We should improve our program and make it work better for us. But we can edit our plan when that happens, not before. So one big reason for this is training, especially training for new staff. If we bring in a new staff member and the operations plan they have access to says something like, we use Athena Health, when actually we're using Cerner, that's going to lead to some serious confusion on for that new staff member. And then when they ask like existing staff members, they're going to be like, wait, where did you read that? We use Cerner right now. So yeah, we need to make sure our plan reflects what's actually happening. So training, and a big reason for this, training to the plan is a really important step of an operations plan. New staff, current staff, from the top of the organization to the bottom, whoever, they should be trained to do what is in the plan. And if that doesn't work, change the plan. That's something we had to do a lot when we were looking through the old documentation in that FQHC plan that I mentioned. They wanted things done a certain way and had written down what occurred in their best possible scenarios. If I remember right, they wanted to use like the Athena Telehealth platform to conduct their appointments. They were having issues with it, so most of their appointments were happening on Doximity, but they didn't want to write that down because they're like, well, what we want to do in an ideal circumstance is this other thing. But because it wasn't written down, it was confusing people who came in. So we updated their SOPs with troubleshooting information and said, like, start with this. If this doesn't work, do this next. So they had what they wanted to happen in there, but they also had their fallback in there as well. They were writing down what was actually happening, not just what they wanted, which is why including troubleshooting information with technology and that sort of process is so important. So we had the information they wanted in there, but we also had information on how to use backup processes if things were stalling. So something I want to take a couple minutes to talk about here is scalability. So we have our plan ready. We've trained our staff on it. Great. But would it work if the program suddenly had to double in size? That's scalability, and that's what we're going to spend a few minutes on here. So why do we need to make sure that a plan is able to suddenly expand? Well, there's a couple of reasons. Emergency operations is a big one. So my initial example of COVID will be evergreen because all of a sudden we saw very small or even non-existent telehealth programs needing to suddenly expand to take in a huge glut of new patients. And this can happen for other reasons. We might have an extreme weather event, some other sort of mass casualty event. Suddenly our operations have to expand very quickly. Can we do it? And if our plan is scalable, yeah, we can. So this can happen in normal operations as well. We might have a new facility. We might have new staff. Our program has expanded. Great. A facility nearby might have closed. We're going to have to see more patients. There's the potential of more resources here, but also a higher workflow. So these are two different reasons why you want to make sure that your plan is scalable. So when we build our plans, we want to make sure that we have scalability in mind for them. And a couple ways we do this is to clearly define roles and responsibilities. So if we say something like, yeah, our administrator is going to handle all the scheduling, obviously that's not going to work if we've suddenly doubled in size. So we want to put limits on things. Administrators will handle X amount of scheduling, whatever works for your facility. Even if you've got one person, it is really useful to put a limit on how many processes that one person can handle in a day. So if we have to bring in additional staff, we can say, okay, we have quadrupled in size for whatever reason. This many patients can be handled by one person, so we're going to need 4 times as many, things like that. So instead of having to rewrite everything, we can go by the plan as written, just expanded. And we should also build in triggers to allow for scalable operations. So when we're talking about how to respond to an emergency, that's where we should put these triggers in. Medical surge is also another thing to think about because we might have a sudden expanding of operations, but it's not going to last forever. And I'm trying to hurry up a little bit, like I said on my chatterbox. So let's talk about new technology for a couple minutes. So when we plan, it's a great opportunity to determine if emerging technologies have a place in our operations. And we're going to take a quick aside here to discuss that. And I promise it'll be quick. So I'm not the expert on performing a technology assessment. That would be our friends up at T-Tech in Alaska. But let's go over quick basics real fast. So there's a lot of new and emerging technology. And like my little subheader said, it's not just AI, but a lot of it is AI. So we have things like AI and ambient documentation that we could potentially institute. If we're not already utilizing remote patient monitoring, we've got that. Patient-generated health data goes along with that. Virtual reality and immersive technologies, and then new telehealth platforms and integrations. So a lot of stuff is always emerging in technology. And because we're telehealth professionals, we are pretty steeped in that. So we should be aware of these things and also constantly evaluating if there's something that can add value to our programs. So when we are evaluating how we utilize emerging technologies, we need to ask, is this an opportunity or is this an operational risk that's going to break everything down? And a useful way to do this is to look at an existing operations plan and see if there are any bottlenecks or any problems, any places that have given your program grief. And if there are technologies available to alleviate that or to solve a problem that you have, that's a great opportunity to look more into that technology and integrate it. Something to note, though, and this is something that I always caution people of when they're integrating a new technology, it's not going to eliminate your operational complexity. Often it's just moving it somewhere new. So if you feel like it's going to solve all your problems, probably not, but it might alleviate them. It's a tool like anything else. And if you think it has a place in your program, awesome. Do a technology assessment and try to integrate it in your planning. So a couple of action steps here with new technology. Like I said, you're going to want to assess your readiness. If you are in planning stages, if you're planning a program, assessing your current plan and seeing if there are any places where you want to try and integrate new technology is a good idea. If you're working with an existing program, just assess if there are any places where you think new technology would fit. Something I always tell people is even if you start small, you should try and start. Be smart about it. Choose one area to pilot a new technology. Don't overhaul everything at the same time. This is true of any planning change. If you have a plan that works pretty good, if you want to improve things, go process by process. Don't say we're going to change everything at once, because if stuff breaks down, if stuff fails, we don't know where that's happening at. This is true of technology, but it's true of planning as a whole. Try to do things methodically, and make sure you're able to identify where changes are happening. And again, this is true of technology, but true of, I think, most planning. Try to engage with your team. The best way to get engagement from a whole team is to involve them with planning and involve them with decision making where it makes sense to. Just emphasize that we are using anything new. We're using new plans. We're using new technology to augment existing capabilities. We're not trying to replace. So we have our plan. We've documented all of our processes as accurately as we can. We've trained our staff on it. We've accounted for emergencies and scalabilities. We even assessed if we should be investing in new technologies. So we're done, right? We're all done? No. So the fun thing about planning is that you're never actually done with it. So we'll talk about the cycle on the next slide. But the main takeaway here is that our plans are made to be used. And that means they're also made to be edited and updated. And that requires regular attention. So when we create a plan, we also need to think about how we are going to maintain that plan, how we're going to ensure that it remains usable and remains something that our organization, our program can continue to depend on. So we want to assign an owner, again, by job title, not by name. We want to establish a review internally, and we want to establish when that's going to happen. We want to do it on a regular basis, something like every year, every 2 years, depending on what sort of organization you're at. We want to capture any lessons learned. So if we have a lesson learned, we want to apply that to the plan. We want to change it. We want to make it better. We also want to ask for staff and patient feedback. Yeah, we might think the plan's working from where we sit, but maybe it's not for our patients or for somebody else in our program. So we want to make sure that we're gathering feedback throughout our process, throughout our program. So we also want to review our plan anytime we incorporate new technology or we change a workflow. And then we also want to do something really important, which is tracking our version and date changes. So I like to add a page right before the table of contents where it says, okay, this is version XYZ, or version like 1, version 2, whatever. And it was updated on this date, and the person to sign off on it was this person. So we can be sure that everyone is working from the same plan. We're like, okay, our current version of the plan is version 3. It was last assessed December of last year. It was signed off on by our program manager. So it's all good. But we want to make sure that we have that revision history. So we are making sure everybody is working from the same plan. It's really important. Okay, so this is my cycle, and this is what we're going to end with. When we're maintaining a plan, we want to create our plan. That's the fun part. We want to gather all of our information, collect it together in a way that works for our program. Next, we want to make sure that everything we have, our equipment, our organization, everything matches what has been written down in the plan. Great. Then we want to make sure that we are training people to the plan. In preparedness, we call the next part exercising, but it can just be regular operations. Just if we need to practice certain stuff, particularly emergency stuff, we can exercise it. We can do like a mock thing with it. But once we're done with that, we want to evaluate and improve the plan where we can. So we've got our plan. We want to train to it. We want to evaluate it. We want to improve it consistently, because that is the best way to ensure that we have a usable, workable, actionable, long-serving plan. So any questions for me?
Thank you so much, Danielle. I don't see any questions in the Q&A just yet, but I do have one question I got in the chat.
Sure.
For a telehealth program that already exists but doesn't have a formal operations plan, what would you recommend tackling first?
First, I would recommend determining who needs to be in the room, create a, I always hate creating like a committee or a task force or whatever, but you need to have somebody who takes ownership of this. So start out by determining who is going to take ownership of it and who are the subject matter experts that they need. Determine the information you already have, gather any SOPs, gather any written documentation processes, put those together, see like, okay, this is what we've got, figure out what you're missing. After that, go to the staff that has that information, write everything down, update what you need, and then meet with your, I would say, meet with your entire program, give them a chance to review, and have them make any changes. So yeah, long story short, I would say have somebody take ownership of this and tell them to get started like in that order. Gather what you have first, no need to duplicate effort, create new stuff you need, and then bring it to your larger organization so everybody can review and suggest changes. Say like, hey, this doesn't actually work like this. Because we can't work unless we're a very, very small organization, very small program. We cannot work every single job. We don't know every single process by heart.
All right. Thank you so much, Danielle. I don't see any other questions in the Q&A. Oh, actually, I do see one. Oh, I missed the first 15 minutes, but are there templates available to help guide us through this process? Also, is there someone who can review or evaluate the plan after we create it?
So we have a lot of like ops planning resources available from the TRCs. I want to say CTRC has a really good one. Contact your local TRC, talk to them about it. They can help connect you with resources. And like I said, we have done this we've worked with a couple different types of programs and help them go over their ops plan. Like that's a place where contacting a TRC is going to be pretty valuable, in my opinion.
All right. Thank you so much. And if you have any further questions, you can always reach out to Danielle. I believe her contact information is provided in the next slide.
Yeah. If you
Perfect.
want to reach out to us at the UMTRC, whether you're in our region or not, feel free. Visit our website at umtrc.org, info@umtrc.org. And like Aria said, TRCs, we're very collaborative. If you reach one of us, we talk a lot. If you reach one of us, you reach all of us. So feel free to reach out to us at the UMTRC, even if you're not in our region. We can get you connected if we don't have the info you need.
All right. Thank you so much, Danielle. And I'm just going to bring up our closing slides here.
Of course.
Just a reminder that our next webinar will be held on Tuesday, September 29th. It has been rescheduled from our regular third Thursday schedule. It will be on leveraging telehealth and mobile integrated health for access to renal transplantation in rural West Texas. Registration information is available on the NCTRC events page. And then lastly, we do ask that you take a few short minutes to complete the survey that will pop up at the conclusion of this webinar, as your feedback is very valuable to us. Thank you again to the Upper Midwest Telehealth Resource Center for hosting today's webinar, and thank you to Danielle for her presentation today. Have a great day, everyone. Goodbye.